Welcome back to my channel. Now we are going to discuss about the axillary lymph nodes. The axillary lymph nodes are a group of 20 to 30 lymph nodes that are located in the axilla in the form of a fascial tent. They are contained in a fascial tent which covers the walls of the axilla. That is, anteriorly you get the pectoralis minor and the clavipectoral fascia. Posteriorly we get the posterior wall that is formed by subscapularis muscle. Medially, we get the intercostal muscles and the serratus anterior over the intercostal muscles. The apical part is formed where all the fascia merge and the base is open and it is directed downwards. So, it is arranged in the form of a fascial tent. And arbitrarily, the axillary lymph nodes can be divided into 5 groups. There is an anterior group along the anterior wall, which is also known as pectoral group. There is a posterior group, which is also known as subscapular group. There is a central group of axillary lymph nodes, there is a lateral group of axillary lymph nodes, and there is apical group of axillary lymph nodes. These are the 5 groups of axillary lymph nodes. In this diagram, we can see this is the axillary vein, which is extending from the lower border of teres major to the outer border of first rib. This is the lateral thoracic vein, and this is the subscapular vein. So we can see the 5 groups of axillary lymph nodes which is located here in the axilla. The anterior group of the pectoral group lie along the lateral thoracic vessels, that is below the pectoralis minor. Then comes the posterior group of the subscapular group which is lying along the subscapular vessels. The lateral group lies posteromedial to the axillary vein along the lateral wall of axilla. The central group is not related to any vessel, it is embedded in the axillary fat, situated close to the base of the axilla. And the apical group of axillary lymph nodes are located along the axillary vein but at the apex of the axilla. So these are the 5 groups, and we will see each group in detail. So coming to the anterior group, what is the location of the anterior group? It is located along the lateral thoracic vessels below the pectoralis minor. It is located along the anterior wall of the axilla. What are the afferents of the anterior group? It receives most of the afferents from the mammary gland and from the ventral part of the trunk. What about the efferents of the anterior group? That is, the lymphatics from the anterior group drains into the central group. What is the clinical significance of the anterior group? The anterior group of the axillary lymph nodes are in direct contact with the axillary tail of Spence. So here you can see this is the axillary tail of Spence, which is in contact with the anterior group of axillary lymph nodes. So if there is a cancer that is involving the axillary tail of Spence, it can be misdiagnosed as an enlarged anterior group of axillary lymph nodes. So that is the clinical importance of the anterior group. Now moving on to the posterior group. The posterior group is located along the posterior wall of axilla, along the subscapular vessels. So it is located along the subscapular vessels. And what are the afferents of the posterior group? It receives lymphatics from the dorsal part of the trunk, and the efferents from the posterior group will drain into the central group. Now coming to the lateral group lies posteromedial to the axillary vein. This is along the lateral wall of axilla and it is lying posteromedial to the axillary vein. So that is the location of the lateral group. Coming to the afferents of the lateral group, it receives lymphatics from the entire upper limb except the lymphatics that is accompanying the cephalic vein. And the efferents drain into the central group. So, central group receives lymphatics from the anterior group, the posterior group, as well as the lateral group. Now coming to the central group, where is it located? It is located in the base of the axilla, in the axillary fat. It is embedded in the axillary fat, and the afferents of central group is from the other 3 groups, that is the anterior group, posterior group, and the lateral group. And the efferents of the central group, it will drain into the apical group. What is the clinical importance of the central group? There is a nerve that passes between the nodes of the central group. This nerve is the intercostobrachial nerve. So the intercostobrachial nerve, since it is in close contact with the central group, if there is a cancer involving the mammary gland and the central group has been involved, it can irritate the intercostobrachial nerve, and that can result in pain radiating along the area of distribution of the intercostobrachial nerve, that is along the medial border of arm. So pain radiating along the medial border of arm in carcinoma breast indicates that the central group of axillary lymph nodes has been involved and the intercostobrachial nerve is being irritated. Coming to the apical group of axillary lymph nodes, where are they located? They are located at the apex of the axilla, medial to the axillary vein, and behind the clavipectoral fascia. So the apical group is situated medial to the axillary vein at the apex of the axilla, whereas the lateral group is also situated medial to the axillary vein, but it is along the lateral wall of axilla. What about the afferents of the apical group? It receives afferents from the subcutaneous lymphatics along the cephalic vein, the upper part of the breast, and the central group of axillary lymph nodes. So the lymphatics from the upper limb, other than the lymphatics accompanying the cephalic vein, drain into the lateral group, whereas the subcutaneous lymphatics along the cephalic vein will drain into the apical group. It will follow the cephalic vein and it will drain into the apical group. Then what about the efferents of the apical group? The efferents is going to form a subclavian lymph trunk, and it is going to drain it to the junction between the subclavian and the jugular veins. So on the right side, we have the subclavian lymph trunk, which will drain into the right lymphatic duct, which will drain into the angle between the right jugular vein and right subclavian vein. And on the left side, we have the thoracic duct. Subclavian lymph trunk will drain into the thoracic duct, which is draining into the angle between the left internal jugular and the left subclavian vein. To sum up the axillary lymphatics, the afferent and the efferent axillary lymphatics, this is the 5 groups of axillary lymph nodes in the facial tent. This is the anterior group along the anterior wall. Then you have the posterior group along the posterior wall, the lateral group along the lateral wall, the central group that is embedded in the axillary fat close to the base of axilla, and the apical group that is located at the apex of the axilla. So the anterior group of axillary lymph nodes receives lymphatics from most of the mammary gland and from the ventral part of the trunk above the umbilicus. The dorsal aspect of the trunk drains into the posterior group of axillary lymph nodes. Then most of the lymphatics from the upper limb, except that accompanying the cephalic vein, drains into the lateral group. So from the anterior group, posterior group and lateral group, the lymphatics will drain into the central group of axillary lymph nodes. Then from the central group, the lymphatics will drain into the apical group. The apical group also receives lymphatics from the upper part of the mammary gland. So the lymphatics from the upper limb, that is accompanying the cephalic vein, will drain into the infraclavicular lymph nodes, and the infraclavicular lymph nodes will drain into the apical lymph nodes. So the apical lymph nodes has the following afferents, that is from the central group of axillary lymph nodes, from the upper part of the mammary gland, and from the infraclavicular lymph nodes, which is draining the subcutaneous lymphatics accompanying the cephalic vein. And from the apical lymph nodes, it forms a subclavian lymph trunk which drains into the junction between the subclavian and the jugular veins. Clinically, the axillary lymphatics are divided into 3 groups. That is the level 1 lymph nodes, level 2 lymph nodes and level 3 lymph nodes based on the position with respect to the pectoralis minor. The lymph nodes that are located below the pectoralis minor is known as level 1 lymph nodes. The lymph nodes that are located behind the pectoralis minor is known as level 2 lymph nodes. The lymph nodes that are located above the pectoralis minor is known as level 3 lymph nodes. So these are the 3 levels of axillary lymph nodes, which helps a surgeon to clinically describe the lymph nodes that has been affected in case of breast cancer. Now between the pectoralis major and the pectoralis minor, there is a group of lymph nodes which is sandwiched between the 2 pectoral muscles. This group of lymph nodes is known as Rotter's lymph nodes. What is sentinel lymph node? Sentinel lymph node is the first group of lymph nodes to which the cancer will spread from a primary tumor. So sentinel lymph node biopsy helps to identify the spread of the cancer. So in case of breast cancer, the sentinel lymph node that is affected is the axillary lymph nodes, and sentinel lymph node biopsy helps to confirm if there is breast cancer. So these are some group of axillary lymph nodes. Now coming to some clinical correlation, let us see a case history. There is a 55-year-old female. She complains of hard, painless lump in her right breast. On examination, the doctor has found pudgy orange appearance of the skin. There is loss of mobility of the breast and retraction of the nipple. Post mastectomy, the patient develops swelling of the upper limb. What is your diagnosis? So here you can see the upper limb has been swollen. The patient is suffering from breast cancer. And what is the reason for the swelling of the upper limb? So when there is breast cancer, most often the axillary lymph nodes will be removed along with the mastectomy. When the axillary lymph nodes have been removed, the lymphatic drainage of the upper limb is affected, and that results in swelling of the upper limb. So that results in lymphedema. Okay. Then what is the most common site of cancer? The most common site of cancer is the upper outer quadrant of the mammary gland. And what is the reason for the pudgy orange appearance? The pudgy orange appearance happens when there is retraction of the hair follicles and there is edema of the skin surrounding the hair follicles. The retraction of the hair follicles occurs because of the cancer infiltrates, and there is stagnation of the cutaneous lymphatics. When there is stagnation of the cutaneous lymphatics, there is edema of the skin around the hair follicles. This gives the appearance of an orange peel, and that is why it is known as pudgy orange appearance. Now, how to palpate the axillary lymph nodes? So we have to examine and palpate the axillary lymph nodes when we are suspecting breast cancer. So the first diagram shows the palpation of the apical group of axillary lymph nodes. The apical group you palpate by pushing the fingers of one hand from the base towards the apex, deep into the apex, and the other hand is placed behind the clavicle to palpate your apical group of axillary lymph nodes. So the first diagram and the second diagram shows the palpation of the apical group. The diagram C represents the palpation of the anterior group of axillary lymph nodes, that is along the anterior axillary fold. The diagram D shows the palpation of the lateral group of axillary lymph nodes along the lateral wall of axilla. Then you have the diagram E, which shows the palpation of the posterior group of axillary lymph nodes. The first diagram shows the palpation of the infraclavicular group of axillary lymph nodes, and the second diagram shows the palpation of the supraclavicular lymph nodes. So you have to palpate both supraclavicular and infraclavicular group of lymph nodes to complete your examination of the mammary gland. So these are the 5 groups. The anterior group is located along the lateral thoracic vessels in the anterior wall of axilla. The posterior group is located along the subscapular vessels in the posterior wall of axilla, and the lateral group is located along the posteromedial to the axillary vein along the lateral wall of axilla. Then you have the central group that is embedded in the fat, and then you have the apical group that is close to the apex of the axilla, and it is lying along the axillary vein. So these are the 5 groups of axillary lymph nodes. When you're doing the mastectomy surgery, you have to remove the axillary lymph nodes by keeping the facial tent intact. So that is known as block dissection of the axillary lymph nodes. So entire facial tent, which includes the all the groups of axillary lymph nodes, is going to be removed. So let us wrap up the topic by looking at some questions. What is the location of the level 3 axillary lymph nodes in relation to the pectoralis minor? Level 3 axillary lymph nodes are located superior to the pectoralis minor. All the following nerves are at risk during sentinel lymph node biopsy except. So when you're doing sentinel lymph node biopsy, when you're removing the axillary lymph nodes, there is a chance for injury to the intercostobrachial nerve, because we know the intercostobrachial nerve is passing between the central group of lymph nodes. The long thoracic nerve can also be injured when the medial, because it is located just superficial to the serratus anterior muscle, which forms the medial wall of the axilla. Then we have the thoracodorsal nerve is also passing down along the posterior wall of the axilla to supply the latissimus dorsi, so that can also be injured. So the nerve that is that has least risk for being injured is the dorsal scapular nerve, because it is passing posteriorly to supply the rhomboids. So the intercostobrachial nerve, the long thoracic nerve, and the thoracodorsal nerve are at risk for injury when you're doing a sentinel lymph node biopsy. All are true regarding axillary lymph nodes except the posterior group lies along the subscapular vessels. Is it a true statement? Yes, it is a true statement. Lies along the subscapular vessel. The apical group lies along the axillary vessels. That is also a true statement. Apical group is the terminal lymph nodes. Yes, among the five, the apical group is the terminal lymph nodes. And the lateral group lies along the lateral thoracic vessels. No, that is the wrong statement in this. The lateral group lies along the axillary vessel and not the lateral thoracic. Along the lateral thoracic, we get the anterior group. The lateral group lies along the axillary vessels. I hope you enjoyed this video. Please do like, share and subscribe to my channel. Thank you so much.